Today is World Diabetes Day. On this day, I would like to celebrate the many advances that have taken place over the past 100 years since the discovery of insulin and have enabled people living with diabetes to enjoy an ever-improving quality of life. Nevertheless, many unmet needs remain. Diabetes represents a huge burden on individuals, but also on society and on our healthcare services. More than 61 million people live with diabetes across Europe. 1/3 of them are undiagnosed. Half do not meet their treatment targets. A complex and multi-phased chronic disease, diabetes is also a root cause of many other NCDs and other complications such as cardiovascular and renal diseases. What we need now is concerted action to improve the detection and early diagnosis of diabetes. We also need timely, uninterrupted and affordable access to the medicines, technologies, education and care that people with diabetes need to best manage their diabetes and avoid life-altering complications. This means engaging people with diabetes in their care and every other aspect of innovation, care model designs, clinical trials, and etc. We need healthcare systems to adopt new innovations and promote their use. And importantly, all of this must be done without leaving anyone behind. 1 year ago, the European Parliament adopted a landmark resolution on the prevention and management of diabetes, acknowledging the urgent need for action on diabetes. This followed several major political commitments and initiatives, such as the Global Diabetes Compact, the Sustainable Development Goals of the UN, or the first ever global coverage targets for diabetes adopted in the 75th World Health Assembly. 1 year on, in the midst of a worsening pharma crisis, the need for action has not lessened. We call on national governments and European institutions to meet their commitments and implement the required policies to improve the prevention and management of diabetes, including through the setup of ambitious diabetes plans with clear milestones, targets, and associated funding. At IDF Europe, we will not stop advocating for more action to improve the quality of life of people living with diabetes and their health outcomes. This is the reason why, together with WHO Europe, we will now be convening diabetes stakeholders and member states across Europe in a high-level technical summit on diabetes, which will take place in Serbia on 28 to 29 of November. We sincerely hope that this will help guide future policy decisions and steer further urgent actions on the part of the national and international diabetes community. On World Diabetes Day, let's unite to improve the lives of the people with diabetes and those at risk and accelerate action on diabetes.